mushrooms support ADHD? Attention Deficit Hyperactivity Disorder, ADHD, is the most common neurobehavioral condition of childhood, but it's often not diagnosed until adulthood. Common symptoms of ADHD include lack of attention and concentration, disorganization, difficulty completing tasks, forgetfulness, losing things, difficulty with decision making, and emotional dysregulation. Those with ADHD often suffer from comorbidities, such as anxiety and depression, which can further exacerbate their conditions. The hyperactivity aspect of ADHD includes activities such as fidgeting, the inability to stay still, talking excessively, and impatience. As reishi is one medicinal mushroom that may be supportive for ADHD. Primarily, its function lies in its tranquilizing effect and ability to calm individuals, which may be of assistance in those who have difficulty keeping still. Additionally, ADHD is associated with sleep disturbances, which may then result in daytime sleepiness and/or circadian rhythm abnormalities. There is no known cause of this disturbance, but possible factors include actions that occur because of hyperactivity and inattentiveness, such as the inability to stay still, poor sleep hygiene, and general technology use at night. A mushroom extract of reishi was studied for its effects on sleep habits both clinically and physiologically. The results illustrated that reishi mushroom extract improved sleep time, sleep latency, and acted in benzodiazepine-like fashion. Benzodiazepines are the most common pharmaceuticals used to treat insomnia, but long-term use can lead to tolerance and dependency, not to mention a bounty of adverse effects. So, is reishi mushroom safe for sleep if it acts in a similar fashion to benzodiazepines? Well, the answer would be that reishi produces its anti-insomnia action without the adverse effects or dependence that are seen in the pharmaceutical usage. Another study found that reishi exhibited antidepressant and anxiolytic effects by antagonism, aka the blocking of 5-HT2A receptors, much like certain antidepressants and pharmaceuticals. Research has suggested that activation of this receptor may lead to anxiety, OCD, depression, fatigue, and decreased levels of sleep. Thus, the use of reishi may combat the comorbidities that tend to develop alongside ADHD. Memory problems are another frequently reported symptom seen in those with ADHD, especially long-term memory. One study found that supplementing the standardized extracts of two constituents from lion's mane, hericenones and erinacine, increased neurogenesis in the hippocampal and cerebellar regions of the brain. While the cerebellar region of the brain is mainly concerned with motor functions, it is the hippocampus that has a major role in learning and memory. Lion's mane's ability to induce the growth of nervous tissue, also known as neurogenesis, in the hippocampus is likely the mechanism underlying its ability to improve memory. Another interesting finding seen in those with ADHD is decreased levels of BDNF. BDNF is brain-derived neurotrophic factor and is expressed in the brain cortex and hippocampus. It regulates two circuits within the brain that modulate attention, thoughts, emotions, social behavior, motor control, and are implicated in ADHD symptomology. Constituents extracted from the fruiting body of lion's mane have been shown to increase levels of BDNF in the brain, along with other neurotrophic factors that may improve the signs and symptoms seen in ADHD.